This is my case study presentation on the topic Nutrition Policy and Obesity in Children, Underserved and Marginalized Populations. Obesity is a major challenge across the world. It's a major health issue, and that has led to an increase in obesity-related chronic diseases such as high blood pressure, cardiovascular diseases, and cancers. Children as well as underserved and marginalized populations are the most affected due to poor nutrition. Once an individual develops obesity-related chronic diseases, it leads to another struggle, which is access to good health care. It is therefore important to address nutrition policies to enact change that will help put obesity in check. In the broader context of public health policy and ethics, obesity is significant because public health agencies have developed policies to reduce obesity, including those that promote healthy eating and limit overconsumption. However, there are ethical disagreements about the best way to achieve these goals. For example, some argue that policies should be designed to balance equality and autonomy, while others question whether it's justified to diminish one dimension of equality or autonomy to increase another. Obesity policy requires consideration of both scientific insights and ethical values. Ethical values include questions about responsibility, choice, and the legitimacy of interfering with personal freedoms. The scope of the problem. Those who are socioeconomically disadvantaged and the different racial or economic minority groups are also at an increased risk of obesity. Some of the factors that lead to this include limited access to quality obesity care, living or experiencing frequent microaggressions and racism, which can ultimately increase chronic stress and the development of obesity. Childhood obesity is also a major concern in many states in the United States, and there exist policies that restrict the sale of unhealthy foods and beverages. For example, sugary drinks, desserts, and even snacks that are sold especially in competition with school meal programs. And this helps to improve the nutritional environment of schools and to support student health. Current approach. One current and existing policy that is related to my topic that I would like to discuss is the measuring and addressing nutrition security to achieve health and health equity policy, which has the main objective as to have accessible nutritious food. Nutrition security can be addressed through multi-level, multi-sectoral approaches. Within health systems, interventions include medically tailored meals, produce prescriptions, nutrition and culinary education for patients and providers, and electronic nutrition security screening and referrals. Population-level programs and policies can improve nutrition security by influencing the community, socioeconomic, and larger living and work environment. Each of these strategies is presented in a new national strategy on hunger, nutrition, and health, according to Muzaffarian in 2023. However, there are several gaps which remain in terms of solving obesity. The current approach is not sufficient, and it is therefore necessary to consider questions of what lends ethical legitimacy to different forms or methods of intervention. Low agency interventions to parties including politicians who may enact interventions, the public who are the recipients of interventions, and food companies whose commercial interests may be affected by interventions. Disrespecting free choice. Some choices are not available at all, e.g. because of the prohibitive costs, and many behaviors are not the product of meaningful deliberation. They also rightly note that freedom of choice as a value is not exhaustive of all values, and particularly that the importance of the public's health is also important. The existing policy on nutrition supports the moral considerations and justificatory conditions in Bernheim et al. 2015. And the ones that stood out were producing benefits, avoiding, preventing and removing harm. For the current approach, the ethical principle that was violated was distributing burdens and benefits fairly and ensuring public participation, because there was no public participation. This is because the policy was made by policymakers and there is no mention of the public participating in the making of the current policy. Now the proposed policy. Two proposed policy recommendations would address the gaps in the existing policy to improve public health outcomes. Schools should implement policies that create a healthy environment for children. For example, they should adopt a policy that only foods of high nutritional quality are sold in vending machines or given to students within school meals. Another important policy is the manipulation of food prices to shift the diet towards healthy foods. This requires using subsidies to lower the price of healthy foods while adding a tax to less healthy foods to increase the price. My proposed policy approach is the best solution because it creates a healthy environment for children, underserved and marginalized populations. Small taxes or subsidies are not likely to produce significant changes in BMI or obesity prevalence. The predicted outcome is improved health and nutrition. Children who receive good nutrition in early childhood are more likely to develop healthy behaviors that can last into adulthood. Children who live in areas with access to healthy foods are less likely to be obese. The policy will be implemented by taxing unhealthy foods, imposing taxes or price increases on unhealthy foods, also by limiting access, limiting the availability of unhealthy foods in certain settings such as schools or in programs like the Federal Nutrition Assistance. Pricing interventions may have some measurable effects on public health outcomes, particularly for children and adolescents, as well as low socioeconomic status populations and those most at risk for overweight. Interventions may have negative consequences such as physical and psychosocial harm, or they may create or worsen inequalities. Privacy, where policy might require asking for personal information such as weight or eating habits, may be sensitive to privacy issues. What can be done is by providing individuals the needed privacy. Now the major constituencies. With the help of stakeholders like the nutrition counselors, members of the public, policymakers, and public health practitioners, I believe that this would help facilitate the needed change. A possible intervention for my policy would be to guide choice by changing the default policy. This ranks fourth in the intervention ladder in Bernheim et al. 2015. The moral foundation theory that I would use to help sway the opposition would be fairness and care. Fairness is where people should be treated fairly and human acts will be reciprocated. Care, where I will emphasize on the desire to care for others and protect them from harm. My proposed policies, therefore, emphasize schools being able to implement policies that create a healthy environment for children and the importance of manipulation of food prices to shift the diet towards healthy foods. These two will help improve the health and nutrition of children in underserved and marginalized populations. My policy might require asking for personal information such as weight or eating habits, which may be sensitive to privacy issues. What can be done is providing individuals privacy. Public health practitioners and policymakers will support my recommendation. The proposed policy measures are likely to be strongly opposed by food corporations. The moral foundation theory that I would use to help the opposition would be fairness and care. Fairness is where people will be treated fairly and human acts will be reciprocated. Care, where I will emphasize the desire to care for others and protect them from harm. With time and patience, this policy will be effective in reducing obesity in children, underserved, and marginalized populations.